To be very, very clear, we're not a diagnostic lab by design. Public health labs are not designed to do that work. We're usually surveillance labs. So we do sort of random sampling in the community to see what's circulating, like in the flu season or other situations. But in situations like these where other people don't have the capability, we're usually the first to come online because we're connected to state and federal resources where most of this stuff starts flowing from. So we're the pinch hitters. We don't have capability to take on a county of 2 million and test everybody. That's just the honest truth. We need help from our commercial labs, and they have come online, but again, they're new to this, so it's gonna be a ramp up. So I just wanna make sure that we get that out there, that don't everybody start sending their patients to us because we just don't have that availability. I'm gonna explain here in a minute why. So as you can see, we've been testing people, and there's been surges, and then there's been decline because that was a weekend, and we're gonna expect another surge in the week, and that happens. And we identified, I think the numbers when we were putting this together yesterday morning were that we had tested 164 samples in our lab, and that was for 64 people under investigation. In the beginning, CDC was saying take about a couple of samples, nasopharyngeal swab and oropharyngeal swab, and then a couple of days ago they said, well, now only nasopharyngeal swabs are going to work fine because we know we have a limited capability across the country. Out of those in our lab, we only found 3 positives out of 164 that we tested. And the important fact to remember is that not all of them were Tarrant County people. We were at about 52% of the samples tested in our lab, and the rest was other counties. And there are things that are happening that are developing, right? So we got an initial kit of about 1,000 reactions and 800 controls. And I know I'm getting into scientific info, but it's important for me to put it out there. Second kit came with 1,000 reactions and no controls. So we, in essence, had capability to test 1,800 samples. That doesn't mean 1,800 people, 1,800 samples. And the limiting factor was how many controls do you have, because you have to run a control. So the strategy was to batch those samples so we can conserve our controls and maximize and get to the 1,800. Yesterday, we ran into a situation where we're starting to run short on our reagents to extract the virus out of the samples. We're not out yet, but we have been talking to our federal partners and they don't have any more in stock and they're trying to get some more in stock. So we're trying to conserve and be very, very judicious of what we do, and that's where we are. And that's the reality. We rely on our federal partners and they're out.
Vinny, you talked today about the shortages of control samples to do testing, and that was basically a difficulty with getting it from federal officials. While you were in here today, federal officials in Washington were saying, we're going to get more out, but we need people to ask for them. Have you asked for those, and what has the response been?
Yes, so we have been in constant contact with our federal officials about our limited capability and the demand in the community. And what I shared earlier, the controls are limited. The reagents are now becoming an issue from where we get our reagents at the federal level. They have told us that they're currently out of stock, but working on getting more. And then also we have automated extractors that are ready to go, staff trained. We don't have reagent for it. And because there was some shortage, they changed the reagent, and that changes the programming cards that go into those machines. And we're being told you have 2 machines, but we're gonna give you only 1. So, it's mixed messaging, I understand, but that's what we've been told. And hopefully we can get that resolved quickly because they do understand and recognize that there's a need all across U.S.